Assalamu alaikum. Today we will be discussing about therapeutic positions, which is again one of the important topics of your nursing foundation. So, therapeutic position is actually the position which we provide patient either during surgery or providing care or doing some kind of procedure or in certain kind of disease conditions. So in this presentation we will be discussing various types of position, how you can provide these position to the patient and what is the importance of these positions. Here is the list of certain positions which we can provide to the patient. The most commonly used positions are supine position, prone position, lateral position, lithotomy position, Fowler's position, semi-Fowler's position, Sims position, Tenderberg's position, knee chest position, and reverse Tenderberg's position. So let us discuss them one by one. Let us first start with spine position. So in spine position, individual is lying on their back with their face and abdomen facing upwards. As you can see in the picture, स्पाइन पोजीशन में जो पेशेंट होता है वो बेड पे लेटा होता है और उसका फेस एंड एब्डोमेन ऊपर की ओर होता है. इस पोजीशन को हम बोलते हैं स्पाइन एज वेल एज डोर्सल रिकम्बेंट पोजीशन. सो ये पोजीशन हम कब यूज़ करते हैं? दिस इज़ द यूजुअल पोजीशन फॉर एडमिनिस्ट्रिंग इधर एनेस्थीसिया, जनरल एनेस्थीसिया, or for doing surgery of the abdomen such as laparotomy, herniatomy and appendectomy, etc. So this is the most commonest type of the position which we can use in case of abdominal surgeries. Second type of position which you can use for the patients is prone position. So prone position is in which the patient lies on the abdomen with head turned to one side and with one small pillow under the ankle. सुपाइन पोजीशन एंड प्रोन पोजीशन, ये दोनों पोजीशन एक दूसरे की अपोजिट पोजीशंस हैं. प्रोन पोजीशन में पेशेंट अपसाइड डाउन होता है लेकिन उसका हेड किया गया होता है टू वन साइड एंड उसके एंकल्स के नीचे पिलो रखा जाता है. एंड ये किन कंडीशंस में हम यूज़ करते हैं? ये हम कॉमनली यूज़ करते हैं फॉर द असेसमेंट ऑफ द पोस्टीरियर पार्ट ऑफ द हेड, neck and spine during spinal surgeries. Next position is lateral position. Lateral position को हम sideline position भी बोलते हैं. Lateral position में क्या होता है? As name indicates, patient lies on one side of the body. And so on the basis of that it can be of two types, either right lateral or left lateral. So patient can be on the right side and can be on the left side. So depending upon, we can say the right lateral position and left lateral position. So इस पोजीशन को हम कहाँ यूज़ करते हैं? मोस्ट ऑफ द कॉमन प्रोसीजर्स जिनके लिए ये पोजीशन हम देते हैं उनमें कौन कौन सा आता है? लाइक इंक्लूडिंग द बैक सर्जरीज, lower extremity surgery, thoracic surgeries, ear, nose and throat surgeries and kidney surgeries. So ये पोजीशन जो है लेटरल पोजीशन मोस्टली हम यूज़ करते हैं किडनी सर्जरीज, थोरेसिक सर्जरीज एट्सेट्रा. अगर पेशेंट की राइट किडनी को सर्जरी करनी है तो हम उसको देते हैं लेफ्ट लेटरल पोजीशन. अगर पेशेंट के लेफ्ट किडनी को सर्जरी करनी है तो हम देते हैं उसको राइट लेटरल पोजीशन. अकॉर्डिंगली अगर राइट साइड ऑफ नेक सर्जरी करनी है तो हम देंगे उसको पेशेंट को लेफ्ट लेटरल पोजीशन. एंड अकॉर्डिंगली अगर उसके लेफ्ट साइड में सर्जरी करनी है नेक में तो हम उसको देते हैं राइट लेटरल पोजीशन. दिस इज़ ऑल्सो वन इम्पॉर्टेंट पोजीशन जो हम पेशेंट को देते हैं बहुत सारी कंडीशंस में. वन मोर टाइप इज लिथोटमी पोजीशन. सो लिथोटमी पोजीशन ऑफन यूज़ करते हैं हम ड्यूरिंग चाइल्ड बर्थ और ड्यूरिंग द सर्जरीज इन द पेल्विक एरिया। तो इसमें पेशेंट को हम कौन सी पोजीशन देते हैं, इसमें हम पेशेंट को यूजुअली पेशेंट लाइज ऑन द बैक with legs flexed. So patient का abdomen and legs they are at 90 degree to each other and patient's knees are bent at 70 to 90 degrees. Also इस पोजीशन में हम क्या करते हैं, हम फुट रेस्ट प्रोवाइड करते हैं सो दैट पेशेंट जो है वो अपने फीट या फिर लोअर लिम्स को उस फुट रेस्ट पे रख के रेस्ट करे. These are used to support the legs of the patient. ये मोस्ट कॉमनली हम इसको चाइल्ड बर्थ में यूज़ करते हैं और यूज़ इट फॉर वेरियस काइंड ऑफ पेल्विक सर्जरी और पेल्विक एग्जामिनेशंस. Another commonly used position, most commonly used position we must say is Fowler's position. Fowler's position can further be of three types: standard Fowler's position, semi Fowler's position and high Fowler's position. तीनों फाउलर्स पोजीशन में डिफरेंस बस एंगल की है कि हम पेशेंट के बैक को किस एंगल पे रखते हैं या फिर हम पेशेंट का जो बैक रेस्ट या फिर हम उसको बोलेंगे बैक ऑफ द बेड किस एंगल पे हम उसको एडजस्ट करते हैं, उसी हिसाब से वी कैन हैव दीज थ्री टाइप्स ऑफ फाउलर्स पोजीशंस. फाउलर्स पोजीशन में सबसे पहले आता है स्टैंडर्ड फाउलर्स पोजीशन. स्टैंडर्ड फाउलर्स पोजीशन इज आल्सो नोन एज स्टिंग पोजीशन, क्योंकि इस पोजीशन में जो पेशेंट हमारा होता है वो स्टिंग पोजीशन में होता है, इसीलिए हम इसको बोलते हैं स्टिंग पोजीशन आल्सो. इस पोजीशन में जो हम पेशेंट का बेड एडजस्ट करते हैं वो होता है एट एन एंगल ऑफ 45 to 60 degrees and the legs of the patient may be either straight or slightly bent. It depends upon the patient whether he wants to keep his legs straight or he wants to bend them slightly. And this position is often used for head, chest and shoulder surgeries. So the most important thing about this position is the angle at which you are adjusting the patient's bed. So mainly the angle should be 45 to 60 degree. 60 से ज़्यादा होगा या 45 से कम होगा तो वो स्टैंडर्ड फॉलोअर्स पोजीशन नहीं रहेगी, नहीं मानी जाएगी. Standard Fowler's position is preferred position for respiratory distress syndrome because in this position patient's diaphragm is slightly lowered and it helps in chest expansion and relieves dyspnea. And due to the positioning of the bed, standard Fowler's position allows for better chest expansion, so improving the breathing and facilitating oxygenation. Other advantages which include it helps in increase in blood and cerebrospinal fluid drainage and improves hemostasis. Next one is our semi-Fowler's position. Semi-Fowler's position is a position in which a patient, either in a hospital or nursing home, he is positioned on their back with the head and trunk raised to between 15 and 45 degrees. Most commonly 30 degrees should be the angle. So as I earlier told you that in case of standard Fowler's position, the angle should be between 45 and 60 degree. But in case of semi-Fowler's position, angle should be less. It should be between 15 to 45. Most commonly we use 30 degree angle. Semi-Fowler's position is used for various purposes like feeding, for lung expansion, cardiac and respiratory conditions, and for the patients with NG tube. It also helps in relieving dyspnea, allowing the patient to breathe, and makes the patient more comfortable. And it totally depends upon the patient's choice, either to place the legs in a straight position, or he can bend his knees. Till now we have discussed two types of positions: semi Fowler's position, standard Fowler's position. The third one is high Fowler's position. So in high Fowler's position, we call it as high Fowler's position because the angle is usually more than 60 degree, as you can see in the picture, and that is why it's also called as full Fowler's position. So it is a supine position in which individual lies on their back on a bed with head of the bed elevated between 60 to 90 degrees, and legs of the patient can be either straight or bent at the knees depending upon the patient's choice. And this patient position is usually recommended for post-operative management in some cases, for feeding, for taking x-rays at bedside, as well as during breathing treatment. So here the angle is more than 60 degree. So in case of high Fowler's position, angle is between 60 to 90. In case of standard Fowler's position, angle is between 45 to 60. And in case of semi Fowler's position, angle is below 45 and is between 15 to 45 degrees. Got it? Okay. After Fowler's position, another position is Sims position. Sims is basically a modified form of prone position or lateral position. Here the patient is positioned at his or her side with such that the upper legs is bent inside towards the chest while the upper arm is bent at the elbow. You can have a look over the picture. Patient lies in prone position. One of the arms and one of the knees is supported by the pillows. And patient's chest is towards the bedside. And this position is often used for either rectal or vaginal examinations and treatments. Another position is knee chest position, or we can also call it as knee to chest position. This knee to chest position is a basic grounding posture that calms the mind and relaxes the body because it enhances circulation to the brain. Because head is placed lower, so that's why it enhances circulation to the brain and the patient feels very calm and relaxed. It can be of two types, like it can be the patient can be in the lateral position somehow, bending his knees with the chest, or he can be in the modified prone position, bending his head towards the floor with the knees flexed. And this kind of position is used in case of spine surgeries or can be used in case of rectal examinations. Another type of position is TENDERBERG's position. This TENDERBERG's position is the position for a patient on the operating table, most commonly used during lower abdominal surgeries and central venous catheter placement. And in TENDERBERG's position, the patient's head is usually lower than the patient's feet. So we can just lower the patient's head at an angle of roughly 16 degrees. But patient cannot be placed in such position for longer periods of time. Or if in case you have to place the patient for longer period of time, in that way we have to in between change the position, bring him back to the spine position, then again you can lower the head and side of the bed. But continuously you cannot place a patient in such kind of position. So the degree of Tenderberg should be minimized as much as possible, and if possible the patient should be repositioning into the supine or reverse Tenderberg position at established intervals. So it means that if you are keeping a patient during surgery on Tenderberg's position, that means you are keeping his head lower to his feet, and in between you have to reposition him. You have to elevate the head side for some time, and then again bring the patient back to the Tenderberg's position. And due to the angle, the Tenderberg position allows for the patient's abdominal organ to move towards upside by the use of gravity, improving surgical access to the pelvic organs. Next type of position is reverse Tenderberg's position. As name indicates, this position is opposite of Tenderberg's position. And the reverse Tenderberg position is a position in which the patient's hip and knees are not flexed, but head and chest are elevated at 30 degrees than the abdomen and legs. As supine and prone positions are opposite to each other, in the same way, Tenderberg and reverse Tenderberg positions are opposite to each other. So this was all about positions used during various surgical procedures. And if you want to provide me with some feedback, so you can comment me, and in case if you like the video, do share and subscribe.